Dr. Tripathi, you spoke about deaths, and that was my next question. There are number of deaths which are happening in young people and children, and of course, India is the diabetic capital. So, talking of comorbidities, talking of young deaths, what is your take vis-a-vis Omicron?
There's some data from the United States which shows that about 40% of children, young children, have been admitted to the ICUs, and around 24 to 25% children have sort of succumbed to the illness.
What about data from India?
Data from India is still emanating. I think it is still early days because though we had the peak already in Delhi and Bombay, and it's coming down now, but the number of children affected are certainly more than what it was with the Delta virus.
Dr. Mahajan, talking of children being affected or infected, and considering you are, administering vaccination, would you say it is time for the government to really open it up for kids and younger kids? Or have we been too late in doing that?
This is a very important question that you asked, Kumkum, and this is a question being asked by parents as well. You cannot just vaccinate based on no evidence. So the safety of the vaccine has to be demonstrated first in a subset, in a particular age group, and only then can you start vaccinating. I don't think we have been late or slow. We cannot actually venture into this field without adequate data of safety and effectivity and efficacy. And when the time comes, it'll happen.
Dr. Sabharwal, are you seeing cases of children being admitted to hospital or coming with infected with Omicron?
We are seeing children being admitted or coming to hospital with Omicron positive. Last night, as I told you, we had a mother, a lady with two twins of 2-year-old age. They have been admitted with positive Omicron variant. The mother was vaccinated, and the whole family is vaccinated, and they are admitted now. But we've had one more child of 3 years who was admitted a few days back, but with very mild symptoms. Most of the admissions that we are having in the hospital are of people who have either have had just one vaccine or are unvaccinated.
Dr. Mahajan, please educate us on nasal vaccine. A lot is being said about that. How accurate would it be? How practical is it? Just take me through that.
See, there are trials that are going on with the nasal vaccine, and probably the Bharat Biotech vaccine would be available very soon. And one, it is much easier to dispense. People are much more likely to accept a nasal vaccine as compared to a vaccine where an injection has to be given. Thirdly, if we talk of the science of it, since these are respiratory viruses and they enter through the nose and the throat, local injection or spray in the nasal cavity, it is presumed and believed that that may actually lower the transmission also, because the initial cells that get infected are in the air passages, and that's where locally this vaccine is being given. So it is thought that it would lower the transmission, being able to kill the viruses right within the respiratory passages itself before they enter into the cells and into the bloodstream.
Dr. Sabharwal, do you think it was right and sensible for the government to delay booster doses, or do you think this is one of the reasons for numbers going up?
The boosters should have started, especially in healthcare workers, earlier, because worldwide they are giving boosters to all, whether they are healthcare workers or or otherwise, general population. I feel that we have delayed it because in our own hospital, I have seen there are a lot of healthcare workers who have suffered.
Dr. Tripathi, do you agree with Dr. Sabharwal?
I don't think we are late, very late, because the rest of the world has also started similarly.
Dr. Mishra, let me conclude by asking you three top of the mind questions. When should we be tested? When should we be retested if found positive? And are there any blood tests that can be done to predict the severity of the infection?
So the first question is, when should we be tested? So we were earlier saying for Delta variant, we were saying to test between fifth and seventh day because the median incubation period of that virus was about 5 to 7 days. But here with Omicron, the median incubation period is much smaller now, and we should test people, on the second or the third day. And who should be tested? As far as my personal view goes, I think all contacts should be tested. The third part is, do you test? When do you test the person again? Actually, there's a lot of directive and advisory that there is really no need. After 7 days, in case of Omicron, the person can go back to work. There is no need to retest.